I use a minimally invasive Achilles tendon repair with anchors in the calcaneus and sutures at the rupture site. It is a technique I've been doing for 9 years now, and used traditionally plastic and biocomposite anchors, but the osseo anchors have been a nice option because now you have less issues with anchor site pain, potentially, with the OSSIOfiber material. And one of the things that's kind of drawn me to it a little bit is you're getting that earlier integration of the bone into the anchor. So the thought is that this is getting stronger over time. Early on with the Achilles repair, there's a bit of stress that's occurring at this implant interface, and traditionally you can get some anchor site pain. With the OSSIOfiber, I think there's less of that because we're getting this integration of the implant to the bone.